Hello everyone. Today's presentation is about the topic the echo features of dilated cardiomyopathy. So first of all, we are going to look into the definition of dilated cardiomyopathy. We can also call it as DCM, and it is a condition in which the heart becomes enlarged and that cannot pump blood effectively, which is causing the heart chambers to thin and stretch and grow larger. Next, we are going to look into the echocardiographic features. So, the first one is the dilated left ventricle. There is an increase in left ventricle's end diastole and end systole's dimensions. So, we can measure this dimensions with the help of MOD and the echocardiography. So, first of all, you have to take a parasternal long axis view and you have to get a still image. You can put the cursor over the LV and you can measure the dimensions. So once you place the cursor at the right point, you will get the results of the end diastolic and systolic dimensions. With the help of that, you can identify whether the LV is dilated or not. So in DCM, in dilated cardiomyopathy, it gives the results of an enlarged left ventricle. So it can be globular or also rounded LV shape. The second one is the global systolic dysfunction. There will be a reduced left ventricular ejection fraction. We know the normal value of the ejection fraction is around 55 to 75. It should be above 50 percentage. But here in this dilated cardiomyopathy condition, the ejection fraction of the left ventricle is usually less than 40 percentage. The next point is there is a diffuse hypokinesia rather than the regional wall motion abnormalities. So you can find the hypokinesia rather than the RWMA. Then the third point is increased left ventricular volumes. So there is an elevated left ventricle's end diastolic and end systolic volumes on both the 2D and the 3D echocardiography. So when usually a chamber gets enlarged or dilated, you can see more amount of volume overflow or overload in the 2D echocardiography. Usually we use the 2D echocardiography. So you can find this also in the 3D echocardiography as well. The fourth one is the mitral regurgitation. Functional MR due to annular dilation and papillary muscle displacement. So there is an MR which is happening because of the dilatation of the annulus. So when the atrium and ventricle it gets dilated, it dilates the annular portion of the valve. So when the annular portion is getting dilated, it uh, it happens to create a valvular regurgitation, and now it is causing the blood from the ventricles to flow backward towards the atrium. So this is called the mitral regurgitation. So it is a condition where the blood from the left ventricle is flowing backwards to the left atrium. So the fifth one is the reduced cardiac output. So there is a low stroke volume and Doppler evidence of reduced forward flow. The sixth one is the right ventricular dilation and dysfunction. It occurs in advanced disease, may see functional tricuspid regurgitation. Then the seventh one is the left atrial enlargement, secondary to chronic LV dysfunction and MR. The eighth one is the elevated filling pressures. We can look into the EA ratio and its abnormalities, shortened deceleration time, and increased E by E prime ratio. So the next one is the intracardiac thrombus. LV apical thrombus may be present due to low flow state. So the final one, the 10th one is the reduced myocardial contractile reserve. In this, it demonstrated on stress echocardiography a blunted increase in ejection fraction or wall motion. Thank you.